This is Dr. S.M. Goel, MD Medicine. I've done my MD and DM both from India and from US. Now I'm at least currently practicing in US. So today I'm talking about a very important topic of increased blood pressure or hypertension and stroke. I'm sure all of you have heard about stroke, or you know about stroke, or Hindi में sometimes they call लकवा मार जाना इसे. So there is no question. All top medical bodies says कि almost 80% of the strokes are because of the persistent long-term high blood pressure, which we have not controlled. Let me be honest with you. In our 40s and 50s, blood pressure starts going up. And there may be other reasons and genetic reasons also that we start having high blood pressure, and it sometimes starts slowly starts increasing. Usually high blood pressure has no symptoms for months and years, so it happens so slowly. But high blood pressure keeps weakening our arteries, and in relation to our brain, keeps weakening arteries, and they can rupture and they can cause bleeding in the brain, and they can cause damage, or sometimes blood vessels, they become damaged, and there's a plaque buildup and it blocks the arteries. It doesn't cause bleeding, but interferes with the blood flow or blocks the blood flows to certain portion of the supplying the part of the brain, and that is it causes damage to the brain. So in the first case we cause the hemorrhagic stroke, and in the second we call it a ischemic stroke. Almost 90% of these strokes are ischemic strokes. The arteries get blocked by a plaque breaks up and goes and damages the blood vessels or blocks the blood supply, and then brain doesn't get, that portion doesn't get blood supply, and then we have a stroke. So high blood pressure has no symptom. That's why we call it a silent killer. It's very important for us to control our blood pressure. Like I said, if we do not control in 80%, especially 130, upper blood pressure more than 130, and lower blood pressure usually, definitely we should keep it below 90. So as long as we manage it, we will do fine, live a long healthy life. But if there is a persistent higher blood pressure and we do not use medications to control it, so either we will have so-called ischemic stroke, or we will, in almost 90% of the cases, and then in almost 10 to 15% of cases, we will have hemorrhagic stroke. Initial symptoms, we may have a warning symptoms. We may have sudden headache, difficulty in speaking, difficulty in seeing. We may recover. We should consider it a medical emergency, and seek urgent treatment as soon as possible. But most important fact here I have to mention is that you got to control your blood pressure over months and years, and then we can really live a long healthy life. Thank you so much.